Hi guys, I'm Olivia. I'm a nurse injector here at Cool Springs Plastic Surgery, and we posted on our social media recently about Ultherapy, and we got a lot of feedback from y'all wanting to hear more about it and see what a treatment looks like. So you might have heard about Ultherapy in the news recently. A lot of celebrities have been opening up about having treatments, with their main spokesperson probably being Christy Brinkley, who looks absolutely amazing at age 64 with just a little bit of help from Ultherapy. A common question I get asked when it comes to Ultherapy is, should I do Ultherapy or should I do a laser? And really, they're two entirely different things, even though they both stimulate your collagen and they both help us to look younger. When the collagen is weakened in the superficial layers of the skin, that's when we see fine lines and wrinkles, and that's primarily where lasers play their role. Ultherapy, on the other hand, sends ultrasound energy into the collagen that's in the deeper connective tissue. So when collagen is weak in this deeper tissue, that's when we can kind of see sagging and stretching of the skin, and the skin's more prone to that there. So if we can increase the collagen here, we can tighten and lift the skin. The ideal candidate for Ultherapy actually has a pretty wide range. There's patients as young as in their late 20s and in their 30s using Ultherapy as a treatment to prevent signs of aging and to kind of keep that elasticity in their skin. It's so much easier to prevent than correct when it comes to aging, so build your collagen when you're young. On the opposite side of the spectrum, there's the patient who is seeing signs of aging in their skin, and they're looking for a non-surgical, non-invasive way to tighten the skin. So this does not replace a facelift, and it won't give the same result as one either. So this is ideal for a patient that maybe has moderate laxity and is just not quite ready for that facelift. I like to stress that Ultherapy is not an immediate result, and that's important to know. You can't rebuild and repair your skin overnight. So just like it takes time to build up muscles, the effects of Ultherapy are seen over about 3 to 6 months, with 6 months being the maximum amount of tightening. As far as downtime, there's little to none with Ultherapy, which is really appealing to people that don't have the luxury to take a lot of time off of work. So you might have minor swelling, occasionally a patient will have a bruise, but there's no post-treatment restrictions. You can go back to doing all of your normal activities immediately afterwards. And the last thing I want to just kind of touch on is that Ultherapy is the only FDA-approved non-invasive treatment for lifting and tightening the brow, lower face, and neck. That's a really big claim for them to have, that they can say that about their product. So in our first patient, we're treating her upper face. Her primary goal was to get a brow lift. Treatments over bony prominences like the brow bone or the jawline tend to be the most uncomfortable, but we do ask for your feedback during the treatment to see if we need to adjust the treatment measures at all. The upper face doesn't take quite as long as the lower face as far as treatment time, because you don't have to do as many depths. But I would say overall, upper face is probably about a 30 to 45 minute treatment. Now for our second patient, we treated lower face and full neck. This treatment takes a little bit longer than the upper face, so plan to be in the office maybe 2 hours or so. When you're looking at the treatment, you can see the transducer kind of glides over the skin. It's sending that ultrasound energy to the correct depth without disrupting the skin surface at all. We offer Ultherapy at our Brentwood location, so we'd love to see you for a complimentary consult if you have any more questions.